PROSTAD was a multi-party collaboration between Lleihau University Health Board, TriTech Institute, Swansea University, with key sponsorship by Cancer Research UK through their Test, Evaluate and Transition programme. It was basically a process optimisation project with the primary aim of reducing the diagnostic time for new suspected prostate cancer patients.
We see approximately 55,000 cases per annum of prostate cancer across the entire UK, probably more like 64,000 cases at present. From a Welsh perspective, we see 3,000 to 3,500 cases per annum with a diagnosis, and we see approximately 600 men unfortunately die from prostate cancer every year. Anything we can do around that diagnostic pathway to reduce the timelines within that pathway has a significant impact on all of the men across our region.
That was our main motivation. Patients were waiting a long time and we thought we could do better and be more efficient in our processes. We also wanted to improve patient communication and the overall patient experience and journey. And as part of the project, we wanted to incorporate best in practice techniques, namely full multiparametric prostate MRI scans and local anaesthetic transperineal prostate biopsies for everyone.
We saw a 28-day reduction in the time from referral to diagnosis. That is enormous. That's an enormous impact. And then breaking that down, we saw a reduction from MRI to biopsy from 34 days down to, down to approximately 14 days. And then MRI reporting was reduced significantly, down from 7 days to within 1 day. So it's basically next day reporting for MRI. What does that mean? What does that mean for all of our men who are waiting for this diagnosis? It means that those that receive a prostate cancer diagnosis receive that in a much more timely manner. But importantly as well, for those men that haven't got prostate cancer, they get to the point of not having a prostate cancer diagnosis a lot quicker, and that obviously then alleviates a lot of the stress and anguish that they're going through whilst they wait for that decision. Since winning the NHS Wales Award for efficient care, we've seen various pieces of work undertaken. First and foremost, we published our evaluative research that provided all of the evidence to support the case for change within Hywel. That fed into a business case with the clinical and operational teams. That business case has been approved, and we will now be moving the PROSTAD pathway into routine clinical service delivery.
This is a big win, and I think really sort of justifies our efforts in making the project work. Prior to PROSTAD, patients were waiting potentially really quite long times, and there was inequity depending on when you were receiving referrals or where that referral was being received within the health board. What this has given us is huge satisfaction in terms of being able to bring around system change for the benefit of our patients.
So as far as sharing all of our work, we shared it not just locally, not just across Wales, but internationally as well. So we've done various presentations. We've done poster presentations in conferences across Wales, across the UK and internationally. We've published a number of peer-reviewed papers within the likes of the BMJ, for example, to share all of this work. So we're sharing this widely because this isn't just a pathway for Hywel. This is a pathway for Wales, but it's also a pathway for the whole of the UK, which is why Cancer Research UK commissioned us to do this piece of work in the first instance, so that we can spread and scale this across the UK. Collaboration is fundamental. We all work in a very demand-focused health environment at the moment, and sometimes we don't have the space, the headspace to lift ourselves above routine care and then look at the opportunities around any innovations.
Bringing around change is possible. I think you need to believe in that and have the dedication. I think it's important that you have the right team around you. I found that it's been very empowering and motivating to the project team members and to colleagues that work alongside us. And finally, it's been really quite humbling to receive thanks and positive feedback from patients and patient groups that have benefited from the project.